Let me tell you something that might shock you. Most nursing students are not failing NCLEX because they don't study enough. They're failing because they skip this step. And the scary part is, you might be doing it too without realizing it. Because the moment you see a question, you want to jump straight into action. But what if I told you that's exactly why you're getting questions wrong? Today, we're breaking down the most important step in the nursing process, assessment. Because if you don't get this right, everything else falls apart. The nursing process is how nurses think to make safe decisions and avoid mistakes. It follows 5 steps: assessment, diagnosis, planning, implementation, evaluation. But listen carefully, assessment is always first. So what is assessment? It's simply gathering information about your patient. Before you do anything, you need to understand what's going on. There are 2 types of data, subjective and objective. Subjective is what the patient tells you. For example, I feel short of breath. That's subjective because it's their personal experience. Objective is what you observe: vital signs, lab results, physical exams. This is where your clinical thinking starts. You need both to get the full picture. Let's act this out. Patient says, I can't breathe properly. What should you do first? For example, I feel short of breath. That's subjective because it's their personal experience. Where do you get your info? The patient, medical records, family, and lab tests. You don't rely on just one source. You piece it all together. As a nurse, your job is to collect complete data and validate abnormal findings. Before you do anything, you need to understand what's going on. Here's the biggest mistake students make. They see a problem and jump straight to intervention. Patient in pain? You want to give meds, but did you check intensity, location, or duration? Without that assessment, your clinical answer is incomplete and unsafe. If your assessment is wrong, your diagnosis will be wrong, so will your plan and interventions. NCLEX question: patient reports chest pain. What do you do first? Correct answer: assess. Not give medication, not call the provider yet. Assess the patient first. Your intervention should always be based on assessment. You don't act blindly, you act with evidence. That is what makes you a safe and competent nurse. Before answering any question, ask yourself, do I need more information? If the answer is yes, then assessment is almost always your correct answer. Quick recap: assessment is first. Collect subjective and objective data. Use multiple sources. Never skip this step. Master this, and your scores will improve fast. If you want more breakdowns, tap the link in my bio to select the RN or PN refresher course. Inside, you'll get full lessons, case studies, and everything you need to pass with confidence. Check my YouTube description for deeper training videos too.
Go to my profile. Once you're in, select the RN refresher course. You'll also find a weekly timetable to help you study consistently and stay on track, so you don't feel overwhelmed while studying. Revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,